we have to understand why uterine infection, how it occurs. I will not get into the molecular details, but just an overview, so that depending upon the production system, one can adopt a strategy. So how it develops, how uterine infection develops. It is the interplay of three important events. It is not just that the bacteria gets into and then establishes itself into the uterus and then leads to uterine infection. It is not so. So the first is host. If she allows that bacteria to colonize, then only the infection will. So why she allows, why she do not allow, that depends upon the animal's immunity. And that immunity is a direct benefit of the nutrition and stress. So if the animals are having proper nutrition and less stress and good immunity, then definitely automatically this will be downsized first. Second is infectious agent. Lot many infectious agents. I will be coming to next slide. But there are some important infectious agents in a particular locality that leads to more number of cases. So if we identify that, for example, if I am from Tamil Nadu in one area, in that area, if I know these are all the microorganisms most commonly occurring, then automatically I can choose a better antibiotic for that particular thing to treat. So that is the why this infectious agent is also very much important. And the third is environment, because this is the one factor which facilitates or otherwise both the host as well as infectious agent. If the environment we manage properly, environment includes all the managemental practices as well here. So then it will be no problem. So almost all these three factors, they play an interplay, and that culminates into uterine infection or eliminates the uterine infection. And almost 100% of the animals immediately after calving, they harbor microbes, they harbor microorganisms in the uterus. And depending upon the animal's immunity, see here almost 100% of the animals, they are infected, means they don't have a normal endometrium and bacteria will colonize. But after that, if the immunity of the animal is good enough to throw or clear all these microbes from the uterus, then automatically the endometrium gets repaired and it leads to normalcy. As I told you earlier, it takes 45 days to eliminate all the imprints of the previous pregnancy. But what happens in between if the animal's immunity is compromised? That's what this, I will say, host immunity and the bacterial pathogenicity, which takes upper, which takes lower. That balances and that leads to development of the uterine infection or elimination. So here then it leads to development of metritis, followed by endometritis and something pyometra and other things. It comes in the subsequent stages. So the main thing here is how much we make the animal to clear herself, throwing away bacteria from her uterus. That is important. If it is impaired, then definitely there will be a definite development of uterine infection. There are some risk factors. As a farm manager, we have to understand to prevent the uterine infection. If you see, this is also again a big study conducted by us only using large number of animals. So these are all the factors. The one factor which I want to highlight here is this one, RFM, retention of fetal membrane. This is the one thing which predisposes the animal for development of any kind of uterine infection. If you see the risk factors that we have analyzed in crossbred, if you have one animal which is not having RFM, one animal which is having RFM, the animal which is experiencing RFM or which has experienced RFM is 106 times more at risk when compared to the other cow for developing uterine infection. Similar is the case with zebu and buffaloes. It is quite high. Buffaloes, my personal, this one is prevent RFM. If you are not preventing the RFM in case of buffaloes, definitely it is going to end up in the uterine infection and the postpartum consequences, especially in buffaloes, it is a little bit aggravated. So this one particular factor, one need to exercise very care at the time of calving so that the uterine infection can be downsized. So I told you about the major pathogens. So we classify generally the pathogens into recognized uterine pathogens. They are always associated with uterine infection development in case of cattle. There are some potential pathogens. They invade, they are in the uterus. Once the immunity is gone down, they take upper hand and they cause. And other things, opportunities, contaminants, they are very less important for us. Forget about them for the time being. We have to concentrate on for this one only. So they are always associated with the endometritis lesion. What are they? E. coli, Archaeobacterium pyogenes, and F. necrophorum, and Provitilla and Proteus is very less. But E. coli and Archaeobacterium pyogenes, these two are the major uterine infection causing organisms, even in our conditions as well. I've taken an example of E. coli here for understanding purpose. So once the animal gets caught, the reproductive barriers are open, the anatomical barriers are not closed, it is open. So there is an infection. The E. coli gets into the uterus, and once it gets into the uterus, in a normal animal I am talking about now. So normal animal, the bacteria produces some of the molecules. They are called pathogen-associated molecular patterns. So they are the pattern specific. They may be bacterial DNA or bacterial lipid or any of these lipopolysaccharide. Because I have taken here E. coli, so I'll go with LPS. So this lipopolysaccharide is the thing secreted by the bacteria, which is in the bound form with binding protein, LPS binding protein. And this is recognized by the TLRs. They are the pattern recognition receptor. Patterns are there in the bacteria and pattern recognition receptors are in the endometrium. And once they recognize this one, this TLR is getting activated. Once, very simply, I am taking about the TLR is activated. There are two mechanisms. One is pro-inflammatory cytokines and chemokines are activated. And you know very well, then they attract the more number of neutrophils inside the uterus. And then they kill all the bacteria and clear off the infection. On the other hand, these pro-inflammatory cytokines, they also help in increasing the acute phase proteins, serum amyloid A, haptoglobulin. So they are very good anti-inflammatory and antibacterial as well. And then some of the antimicrobial peptides like defensins, beta defensins. So once the animal is very good in the immunity, so these two mechanisms, this is the bacterial elimination by neutrophil, and then these acute phase protein and antimicrobial peptides, they help in eliminating or removal of majority of the microorganisms that are colonized into the uterus at the time of calving or immediately after calving. So this is a normal case. So what happens? It is a big question. Why few animals cannot clear infection? So in the left side, I have talked about normal animals, so I'm not going to explain. But you see the right side, this poor fellow. What is the body condition of this poor fellow? And we expect that this poor fellow should eliminate everything. So here what happens, this animal is suffering from negative energy balance. What is negative energy balance and how it is important, I will be explaining in the later part. So once negative energy balance is occurring in a particular animal, that animal, the composition of or the NEFA or the concentration of NEFA non-esterified fatty acids and beta hydroxybutyric acid, ketone bodies. So they are elevated in that animals. And these molecules, they directly affect the neutrophil function. They are directly affect the neutrophil function. So even if the animal is managing to draw the neutrophils into the uterus, because the functional competencies of that particular neutrophils are compromised, they cannot eliminate or they cannot kill the bacteria, they cannot eliminate. So that's how, in this case, even if you treat the animal with the more potent antibiotic or other things, the results are not to the tune of when it is being used in a normal animal. So that is the one thing which we have to understand. They cannot clear the infection as well as they cannot respond to the treatment what we are going to give.